Hi, I'm Simon Sorensen, an MD from Denmark and a PhD student at Stanford University. I'm very excited to share some of our latest research on PFAS exposure and its potential link to urological cancer risk. So, what are PFAS and why do they matter? PFAS are synthetic chemicals used in many industrial and consumer products like nonstick pans and firefighting foams. Unfortunately, these chemicals do not break down easily in the environment and can accumulate in our bodies over time, a process also known as bioaccumulation. This raises concern about the potential health effects, including cancer. So, what did we do in our study? In our nationwide study, we analyzed PFAS levels in public water systems across 2,136 US counties from 2013 to 2015 and looked at whether they were associated with county level urological cancer rates between 2017 and 2021. The cancer that we studied included kidney, bladder, testicular, as well as prostate cancer. Key takeaways from our study: counties with detectable levels of certain PFAS compounds had a higher incidence of bladder and kidney cancer. 5 specific PFAS compounds were linked to increased bladder cancer rates. However, just a single PFAS compound was also associated with a higher incidence of kidney cancer. And more importantly, we also noticed, or we did not observe, a significant association between PFAS exposure and prostate as well as testicular cancer. So, how can people access information about their PFAS in their water systems? If someone wants to know the PFAS in their local water supply, they can start by contacting the local water utility and see if the data is available. Also, the US Environmental Protection Agency, also known as EPA, does collect PFAS data. However, because EPA only samples a portion of US water systems, it may not capture PFAS data for the entire community across the US. So, were there any additional risk factors in these areas? Some of the variables we controlled for in our analyses included demographic, socioeconomic, as well as health related factors, and those could also play a role in urological cancer risk, but that was not the main focus of our study. It's very possible that PFAS is acting as a marker for other underlying factors related to cancer risk. Since we looked at PFAS levels in water supply and cancer rates across entire counties, and we did not look at individual patients, the findings from our study should be seen as hypothesis generating. I feel like to better understand these potential associations and to clarify whether PFAS or other factors are driving these observed patterns, we do need patient level studies. Thank you very much.